Nowadays, most of the medical coders are entering into medical coding, especially into HCC coding. As most of the coders feels HCC is little bit easy compared to all other specialties. Newcomers are entering into HCC coding, but they don't know how to analyze HCC charts. Hence, in order to help the no coders as well as the seasoned coders who are currently working as a HCC coder need to know the steps in order to code HCC chart. In this session, we are going to see HCC coding audit form explained a step-by-step guide. Using this audit form, whether you are a new medical coder or if you are a seasoned medical coders, you can audit the HCC chart and code properly. My name is Harish Gupta. I am the creator of FastCoder 21 YouTube channel. Today's agenda is we are going to learn what is HCC coding, and we are going to learn key aspects of HCC coding, and we will see audit form. First, we will see HCC coding. So what is HCC coding? HCC coding refers to hierarchical condition category coding, a risk adjustment model used primarily in healthcare to predict patient healthcare cost and to adjust payment for health plans. So basically, in HCC coding, based on the patient's current year diagnosis, predict the upcoming year healthcare costs, which is most of the time very useful for healthcare plans. Mostly we will use HCC coding in Medicare Advantage. Now we will see key aspects of HCC coding. First, we will learn about HCC codes. HCC codes are derived from ICD-10-CM diagnosis codes reported during patient encounters. Each HCC has an associated risk factor that contributes to a patient's total risk score. So, in HCC coding, we will use only ICD-10-CM code, where each and every HCC code will contains risk factor score based on patient's age, gender, and disability status. Next, risk adjustment factor. If the patient's risk adjustment factor is high, means they are sicker patients, leading to increased funding for their care. Next, conditions that impact HCC coding, mostly which includes chronic illness, severe or life-threatening diseases like cancer, conditions that require continuous management. Next, we will see common HCC models. So we are having two types of HCC models. First one is CMS HCC, which we will use for Medicare Advantage, and we are having HHS HCC used for commercial insurance and other ACA plans. If anyone looking for APC's local chapter, webinar links for free CUs, medical coding jobs in India, USA, UAE, join in our WhatsApp group. WhatsApp group link is in the description of this video. Named as FastCoder 21 YT WhatsApp link. Next, importance of accurate documentation. In any medical coding specialty, proper documentation and coding are crucial to reflect the patient's true health status. In order to code HCC codes properly, we need to have the proper documentation, which is crucial for the patient's true health status. Incomplete or inaccurate coding can lead to underpayment or audits. Hence, whenever we code HCC chart, first we will need to check for the accurate documentation, and based on documentation, we will code it properly. If you code incomplete, inaccurate, which will lead to underpayment or audits. Next, we will see challenges in HCC coding. Coding must meet strict guidelines to be valid. So, diagnosis must be current, documented by a qualified provider, and treated or adjusted during the current encounter. You can't code previous encounter diagnosis during current encounter or current visit. So, in order to get accurate documentation, we need to provide the physicians or providers regarding the value of appropriate documentation. Now we will see examples of few HCCs. So for example, if we take diabetes with chronic complications, HCC is 18. Whereas COPD or chronic obstructive pulmonary disease, HCC is 1111, And if you take major depression, bipolar disorder and paranoid disorders, HCC is 57. If you like this session, please click on like button in order to motivate me to provide more valuable videos regarding all medical coding specialties. Next, we will see the risk adjustment audit form. So first section, we need to check the patient information, patient name, date of birth, date of service, medical record number, provider name, specialty, clinic or facility name. So basically section 1 relates to patient information. As whenever you code or you are planning to code any chat, demographics plays very important role. Hence, we need to check the patient's information first. Next section is documentation review checklist. So first one, does the documentation support the patient's condition? Next, is the diagnosis documented with specificity? Like we need to use here ICD-10 CM guidelines. These are basically yes or no questions. So third one is the diagnosis supported by history, physical exam, assessment plan, labs and imaging? Fourth one, are chronic conditions addressed and properly coded? Next, we need to check is the documentation clear, legible and complete? Next, also we need to check are there any coding discrepancies? So these are yes or no questions. So whenever you want to code HCC chart, you need to check all these specificities in your documentation. Section 3 is HCC validation checklist. First column relates to HCC code, next condition, next documented diagnosis, validated, yes or not, and notes comment if it is necessary. Section 4 is audit findings. First of all, we need to enter total number of diagnoses reviewed during the audit. Next, number of HCCs validated. And next, we need to enter number of HCCs discrepant and what are the discrepancies identified during the audit. Next one is section 5, which is recommendations. So provide education and documentation improvement to the coder, review of coding guidelines for specific conditions, re-audit recommendation in based on the company's whether it is 1 month, 2 months or 3 months. It will depends on the company's policy. Next section 6 is auditor information, auditor name, auditor certification, date of audit and signature. Basically, this audit form will be used by any coder. If you are a initial coder, you are entering into HCC coding, or if you are a seasoned coder, you are performing the auditing of junior coders. Thanks for visiting our channel. If anyone looking for same-day surgery coding training, please send WhatsApp message to 707-526-3939. If you like this session, please click on like button in order to motivate me. And also comment if you are having any concerns or doubts. And also subscribe if you are visiting for the first time. And also share if you like this session and if you want to help other coders.